Here we are with my lovely patient Esther, and Esther is here for her one-year follow-up from her second surgery. She's had 2 surgeries. We've moved approximately 37 to 3,800 grafts on her, and we worked exclusively in her frontal hairline. When she came in originally, she had a lot of trouble with thinning and just difficulty managing the way your hairline presented.
Yes. I noticed that it was thinning in the front, and I already had an unusual hairline, and I didn't know if it was from medications because I was on Accutane for a long time. I didn't know if it was from birth control because both medications involve hair loss. I didn't know if it was a thyroid problem, but I got that ruled out when I saw an endocrinologist. So I went to go see a dermatologist, and I was told it could be hereditary.
It was very thin, classic female pattern loss, but she had very good hair, very good donor hair. So we talked about the process. We talked about doing the first procedure and how we might need to come back and do a second one. She had exceptionally nice results from the first surgery, but we decided to go ahead and let's go for the full Monty, if you will, and add some more density in the second surgery, which we did a year ago. So here we are, 2 years into this, and we have completely restored your frontal hairline. It looks fantastic to me. How do you feel about it?
I feel great. I'm not focused on the areas that I felt that were noticeably thin. Now I feel like I could focus on hairstyles, and I'm not always looking directly in those areas that I noticed that were thinned out.
What I like about Esther's case is that most people would say that this is a difficult case because she's got dark hair and light skin. But truth is, if you do this properly and you move the right number of grafts in the proper fashion, it'll look very natural. What we've got as far as this beautiful female hairline that nobody would ever be able to detect that this was transplanted.
I would say if there's women out there that are wondering what they could do if they were in the same situation as myself, I would say go ahead, book a consultation, because you never know if you're going to be a good candidate unless you ask.
Now you never have to worry about, being embarrassed about your hair ever again.
No, I don't. I can focus on other things.
Beautiful.
Thank you.
You're more than welcome. I was happy I was able to help you. You're a lovely lady, and now it's even more apparent.
I feel so much better not having to focus on those thinning areas that I had noticed years back. Now I feel like I can focus on the hairstyle that I want and not so much just looking at the areas that I noticed that had thinned out.